Of the 40 million people with hearing loss in the United States, 25% of those, or 10 million, have lost hearing resulting from exposure to too much noise. But how much noise is too much? Measured as decibels, the acceptable manufacturing noise standard is to allow a daily exposure up to, but not over, 85 decibels in an 8-hour period of time. More than that can cause permanent injury to our hearing. This is likely due to wear and tear on the tiny little hairs that vibrate when sound is introduced. It's like a daily line of college kids walking too often across one path on the grass. A little is fine, too much kills the grass. The average conversation, for example, is usually around 50 to 60 decibels, street noise is at 70 to 80, and an operating lawnmower at about 90. Single loud sounds like gunfire at about 150 can also be damaging, but realize that the time exposed to lower volumes are the unrecognized danger we face daily. Noise levels above 90 come from surprising places like screaming babies, convertibles driving at 60 miles per hour, marching bands, leaf blowers, hand and hair dryers, and those noisy electronically amplified concerts. Now a new threat has turned up. Tuning out the world with earbuds while turning up the tunes for hours can be like riding on that 2-cylinder John Deere tractor with no cab all day while cultivating corn. Those old 2-cylinders were really loud, and so it can be with earbuds. Earbud volumes at 100 decibels for as short as 15 minutes can damage hearing. Again, it's the volume multiplied by the time that makes it so bad. One study showed that 97% of third graders had documented exposure to hazardous sound levels. And another showed that 12.5% of 6 to 19-year-olds in the United States already had hearing loss directly attributable to noise exposure. What's more, earbuds can be even more dangerous if the volume is too high, blocking out the ambient outside noise, which is needed to avoid danger. For example, walkers, runners, and bicyclists need their ears to hear when a truck might be coming from behind. Of course, it isn't just noise that can reduce our hearing. Infections, trauma, and even medications like antibiotics, chemotherapy drugs, or pain medicines can do it too, and we need to be aware. But more than that, we need to take home this message. For today is to protect ears by avoiding exposure to too much noise, and that the noise from earbuds is a new and dangerous threat.